This is an example of inserting a Hydrus stent at the time of cataract surgery in a patient with a previous trabeculectomy. And so if you look, this is a left eye. I'm testing the Hydrus here, so I always test the injector first. I just want to move that Hydrus as close to the tip of the injector as possible, so when you get in the eye, it takes the least amount of movement to get it inserted. And so if you see here, that's that second Hydrus incision. I always shoot for inferior nasal placement, and so that incision is superiorly in order to allow me to put it inferior nasal, which is where the majority of the collector channel should be. If you look at the top of the eye there, you can see that blanched conjunctiva. That's from the mitomycin in the previous trabeculectomy. I've had very good success inserting Hydrus in these patients in particular. I've tried a number of different things. I've tried istents, I've tried ABICs, I've tried ABIC GATs, and Hydrus seems to be the best in these patients, and it's able to usually remove 1 or 2 medicines at the time of surgery. So in any of your previous trabeculectomy patients that are now currently back on a drop or two, a Hydrus is a great stop at the time of surgery to see if we can get them off as many drops as possible. Thank you for taking the time to watch this video.